These are medications that stimulate the parasympathetic nervous system and mimic the neurotransmitter acetylcholine. And the acetylcholine is found where? In the synapses. It's very easy to remember when you see the actions and the side effects, and all of a sudden you are targeting toward that organ. Don't do that. Remember, these are affecting the nervous system. They're not affecting directly that organ, but affecting the nervous system, which is affecting the organ. Okay, you need to remember that. Otherwise, you get stuck on that heart, lungs, whatever else, and you'll miss the big picture. And these, we have cholinergic receptors and nicotinic receptors, as you can see there, and what they do. So where are skeletal muscles found? On the skeleton. Very good. Okay.
Looks like it's that quick.
Where are smooth muscles found? But everywhere else.
Mm-hmm. Everywhere.
Primarily your blood vessels and your intestines and your bladder. Exactly. Pretty similar to the last ones, aren't they? As far as what organ systems they affect, pretty similar. We will see a lot of these medications in other parts of the body because they are specifically used because of how they affect the body. They're specifically used on certain systems. Cardiovascular system, GI, GU, eyes, and so forth. Questions? I'm not going to read all that. Now this is an actual picture of a nerve. As you can see, if it was an artist rendering, you would see, no, it is an artist rendering. You see letters on there. Anyway, you can see how the direct-acting parasympathetic cholinergic drugs act as they go from one area to the other and into the receptor sites from one here to the other. Again, you have to remember that they come over and they're assisted or they are delayed by what is inside of here. Either we have our blockers or we have our agents, our catecholamines that are actually affecting by making them come across easier, more effectively, or they're blocking them to prevent them from coming over or to slow them down. So you have an action. Understanding that, we have medications like Reglan, which increases gastric emptying. It's interesting. What's another use of Reglan? Anybody know?
For nausea and vomiting.
Nausea and vomiting. And a off-label increases the appetite because it decreases nausea, vomiting, and then the emptying, it actually enhances that. It's kind of a sidebar versus it's made to do that. It's just kind of because of the other effects that happen to do that. And then we have Hylocar and we have uricoline, okay, and as you can see up there, what they do. Side effects. Botanicol. I wonder why I have one whole slide with just one medication on it. I wonder the importance of that. But all these side effects are caused by what? Don't tell me the medication. What are these caused by? Because we are affecting what? What part? Parasympathetic nervous system, what helps us with all this. What is the main reason for a parasympathetic nervous system? Say it louder.
Me?
Yes.
Fight or flight.
Fight or flight. I learned flight when I was younger. Kept me alive longer. That's a story for another time. Nursing interventions. Look at, again, how these things are affecting the body. How the side effects are affecting the body is going to be how we treat or interact with that person. We know that it causes hypotension and it causes some bradycardia, so that the person rises quickly. Then they have what's called orthostatic hypotension. In days gone by, they used to call it what? Who knows? The vapors. The vapors. He has the vapors. Loosen her corset, put her in the back room, let her breathe a little bit, and then go back out there again. And then we have the agonists. Okay. And they are affecting, or as they are either increasing or decreasing the effect of the chemical action within the cell. Questions so far? Okay, I've got 20 minutes till, so why don't you come back at 5 minutes till?